Hello everyone, myself Preeti Sharma, Assistant Professor in AKtU College of Pharmacy, Ghaziabad. So, today I will discuss a general principle of prevention and control of acute respiratory infection. As all know that what is acute respiratory infection. So, these are some learning objectives. At the end of the session, the learner shall be able to basically I will discuss some of the classification of acute respiratory infection, its management and prevention and the control of acute respiratory infections. Basically today in this presentation I will focus on the prevention and the control of acute respiratory infections. So, as all knows what is this acute respiratory infections, especially pneumonia, means it indicate an infections of any part of the respiratory tract of less than 13 days durations and other otitis media of less than 14 days duration. Means we can say there is a infections in the upper respiratory tract or in the lower respiratory tract, and this respiratory infection basically caused by the bacteria and the viruses. Some of the viruses like rhinovirus, enterovirus, coronavirus, these are some viruses, influenza A, B and C, and the bacteria for example, we can say the Corneobacterium diphtheria, and the sign and symptoms of ARI, in the short we are saying the ARI, acute respiratory infection. It include the acute episode of running nose, cough, ear discharge, hoarseness of the voice, breathing difficulties, fast breathing and chest indrawing with or without the fever. And we can say upper respiratory tract infections include the symptoms like common cold, pharyngitis, laryngitis, otitis, itis. At the last I am saying the itis, pharyngitis, itis means here I will show. I am saying the symptoms like pharyngitis. Itis means the word ends with the itis, it indicates the inflammation. Inflammation. If the word end with the itis, then we can say there is an inflammation in the pharynx. Laryngitis means there is an inflammation in the larynx. Otitis means there is an inflammation in the ear. So, you have to understood here that itis means inflammation. Now, I come to the next. A significant problem in the communities, we can say high rate of under 5 mortality and a huge burden on families and the health system, and there is a priority and the essential in achieving the MDG 4. I will discuss in the next slides what is MDG 4. Now, the next is to reduce the under 5 mortality rate by 2/3 by 2015, and when it is compared to the 1990. This is the pneumonia cases. We can see pneumonia kills more than more cases of mortality has been seen in the children under 5 years of age than any other illness in every region of the world, or we can say it is estimated in the data that 9 million child death in 2007, around 20% were due to the pneumonia. Here at the millennium in 2000, the United Nations member state committed to achieving the Millennium Development Goal 4 MDG4, since it is progress has been made in reducing the child mortality. This MDG4 is basically in the United Nations for achieving the we can say for reducing the child mortality. This member state committed it to achieving this development MDG4 development goal. Basic goal to reduce the child mortality here to prevent the means basically we have seen here that 9 million child death has been observed in 2007 and around 20% were due to the pneumonia. So, this development goal for achieving or we can say to reduce the child mortality, and if the current trend continues, an estimated 13.2 million excess death will occur between the 2010 and 2015. In addition to prevent this acute respiratory infections, or we can say to prevent this treatment, such as routine vaccination is required for each and every person. We can say next is exclusive breastfeeding and complementary feeding should be required, and strategy that may be focus on the community development can reduce the pneumonia mortality in developing countries. This MDG4 strategy will reduce the pneumonia cases, or the ultimately it will reduce the child death in the various developing countries. Means each and every person should be vaccinated and should avoid the close contact and cover the nose and the mouth when coughing or sneezing, and use the disposal tissues to contain the respiratory secretions. Disposal tissue we have to use to basically to control this respiratory secretions and immediately dispose it. Now, these are some quality cares at the first level in the public health facilities. First one is improving the quality of care at the first level public health facilities, which is basically ensuring they are financially, logistically and geographically accessible, and even there are some barriers for preventing the parents from using these facilities. Means some of we are improving this first level qualities in the public health facilities. So, in the next we are comparing, means improving the quality both in the public sector as well as in the private sector. Means in both the sector we have to improve the quality of care, means how we can prevent or how we can control these infections in both the sectors, whether in the public health facilities or in the private sector. So, we have to focus on some points to improve this quality in the private as well as in the public sector. First point, to avoid the close contact, we must avoid the close contact in the public places and cover the nose and the mouth when coughing. And first we have to remember all must have to be vaccinated. All must be vaccinated, each and every person should be vaccinated. First is the most important point that all should remember. Avoid the close contact, cover the nose and mouth when coughing or sneezing, and as I told you, use the disposal tissues using the respiratory secretion or that must contain the respiratory secretion and immediately dispose of them. And we can say wash your hands regularly, keep sanitizer with you and sanitize all your personal items like various utensils and the doors handles we are using, all must be sanitized. Means keep sanitizer close, so you can sanitize your personal items with that, and do not touch your face. If means after sanitizing your hands, you must have to touch your face or your body parts, and smiling. For smiling is also a boost for your immune system, means it will increase your immunity power. If you if the person is smiling, means it will enhance your immune system. And eat the right and the healthy and nutritious food. It is necessary to eat the healthy food and nutritious food. And in many settings, especially in the urban areas, children are often treated in the private sector. Although active collaboration between the public and the private sector is relatively new strategy, and there is no conclusive evidence showing which approach is most effective. Intervention involving the private practitioner should be continued to be pursued. Private practitioner means private doctors should continue or improve the quality of care in the private sectors by following all these points. Now, the next one is increasing access to quality care can be achieved through community based care. Next one is community health workers can be trained to assess the sick children for sign of pneumonia, select the appropriate treatment, administer the proper dosage of antibiotic, and counsel the parents on how to follow the recommended treatment regimen and provide supportive home care. Means after administrating the proper dosage of antibiotic, these are some points you have to remember for the health workers. Means community health workers have to be trained on this proper treatment. In the appropriate treatment, all must have to be keep remember. And supportive home care, follow up sick children and refer them to a healthy facility in the case of complications. Now, here the ARI short, I told you that acute respiratory infection is known as the ARI. It is a control program was started in India in 1990, and it sought to introduce scientific protocol for case management of pneumonia with the cotrimoxazole. Cotrimoxazole is basically for the, it is a scientific protocol for the pneumonia, case management pneumonia with cotrimoxazole, means antimicrobial. Since 1992, the program was implemented. It was started in India in 1990, but it was implemented in CSSM and later with RHM. It was implemented in 1992. Now, the next is integrated management of neonatal and childhood illness, offer a comprehensive package for the management of the most common cause of childhood illness. Therefore, the various measles, sepsis, malaria, diarrhea, pneumonia and malnutritions. If the patient is malnutrient, its immunity level will down, means the immunity level will decrease and the patient will capture the infection very quick. So, all must to prevent this infection or to prevent itself from the infection, we all have to take proper nutrition and healthy food, means eat at the right time. Healthy food and nutritious food is the best to avoid the malnutritions. So, ultimately by avoiding this malnutritions, we can protect ourselves from the infections. Now, this is a management of child with a cough or difficult breathing, assessing the child by asking, classifying the illness of the child, decision for the treatment and follow up the cases. Means here the management, how we can manage this difficult breathing and the cough by classifying the illness means severity. How the severe is the infection? First of all, we have to focus on the severity of a disease or in the severity of the infection. Here some of the points here given that all must have to give a few focus on this. Count the breath in 1 minute. First of all, look, listen and feel. Count the breath in 1 minute. Look for the chest in drawing. Look and listen the street door. Look and listen the fees. See if the child is abnormally sleep or difficult to wake up. These are some points all must have to remember. First one is, here the table is given, that is basically the age of the child. If less than 2 months, 60 breath per minute or more. Here you can see, if less than 2 months, 60 breath per minute or more. If 2 months or up to the 12 months, it must go to the 15 breath per minute. 12 months or up to the 5 years, it must go to the 14 breath per minute or more. Now, the classify of the illness, the purpose to make decision about the severity of a disease means all must have to classify the illness, means the infection. We have to know the severity of a disease, whether it is severity means whether it is severity in the higher, low or medium. We are classifying according to this the infection, and then we are choosing the line of action or treatment. Which type of treatment we have to give to the patient, that must have to be seen on the basis of the severity of a disease, and it is done on the basis of danger sign and the respiratory rate. As I told you, the various sign and symptoms which has been seen during the acute respiratory infection, that is like common cold, pharyngitis, laryngitis and the otitis. These are some symptoms or the dangerous symptoms which can be seen in the upper respiratory tract infection during the ARI. And the lower respiratory infection like bronchitis, pneumonia, these are some sign and symptoms. It is basically done, means classification, we are classifying on the basis of the sign in the upper and the respiratory tract infection and in the lower respiratory tract infections, and we are ultimately our goal to choose the treatment. We are finally we are choosing the treatment, which type of treatment we have to give to the patients on the basis of the classification. Now, next is treatment guidelines and follow up. Young infants between 0 to 2 months and child 2 months to 5 years. Now, this is some of the home care prevention and the controls in the acute respiratory tract infections. Mother should keep the baby warm, continue the breastfeeding and feeding the child, increase the feeding after recovery, and clear the nose if it is interfering with the feeding, and proper dosage of antibiotic for 5 days. As I told you that cotrimoxazole is given in the pneumonia, like or we can say antibiotic, proper dosage of antibiotic should be given for 5 days, and cough can be recovered by homemade decoctions, means homemade decoctions is relieved, give a relief to the cough, and to bring back the child after 2 days for the reassessment and watch for the danger sign. These are some home care remedies or home care we can say ki home care preventive measures which can be given by the mother to their baby. Keep the baby warm and continue breastfeeding and feeding the child, increase the feeding after recovery. Now, these are some key strategies for treating, preventing and protecting from pneumonia. Case assessment at all level, improving the nutrition and reduction of low birth weight means all must have to remember that eat the right food, healthy and nutritious food. If the person is eating the nutritious food, means it should not captured by the infection, because the immunity power, if the immunity power is very low, then there will be a more chance of capturing the infections. If we are eating a nutritious food, it is better for the means it will prevent us from the pneumonia, or we can say from the ARI, acute respiratory tract infection. Now, this control of indoor air pollution, vaccination, as I told you, get vaccinated, each and every person must be vaccinated in a proper way. Now, effective case management at the community and healthy facility level is an essential part of pneumonia control. Countries with significant rate of under 5 mortality should adopt plans to expand educate cases management of pneumonia at hospital, health facilities and community level to achieve the 90% coverage within a predetermined time frames. Means adequate cases management means we have to manage all the cases which has been noted in the various hospitals, means 90% within the predetermined time frame we are giving the preventive measures and giving the various antibiotics like get vaccinated. As I told you, wash your hands regularly, keep sanitizer, all must have to do, all these points have to be remembered. So, we can protect each and every person from this acute respiratory tract infections. And exercise daily, it is a most important parameter, that exercise daily and stay at home. Now, the promotion of exclusive breastfeeding and zinc supplement are also important element of pneumonia prevention. This is here we can say ki if the person will take the zinc supplements are very important element for the prevention of pneumonia. Strategies to reduce the rate of low breath weight and malnutrition will prevent the pneumonia and should encourage the patients. Now, some of the exclusive breastfeeding and zinc supplement is also important, as I told you. It will reduce the rate of low birth weight and malnutrition will prevent the pneumonia. This means this if we will take, or we have to remember this all parameters which I discussed in the slides, that we have to focus on the avoid close contact, cover the nose and the mouth when coughing and sneezing. So, we can prevent each and every person from this acute respiratory tract infection, or we can say we can prevent the person from the pneumonia. It should be encouraged. And basically I told you that this bacteria and pneumonia, all this be prevented with the help of using the disposal tissue to contain the respiratory secretion, and immediately you have to dispose of them. And vaccination, use the antibiotic like cotrimoxazole. You have to use the antimicrobial if the person is suffer from ARI, means acute respiratory tract infection, then should use antimicrobial. And the best method to vaccinated, if the person is vaccinated, it is one of the most important parameter to prevent and control the ARI, means we can prevent this ARI with the help of this vaccinations, or by using the sanitizer is one of the most important. Mostly we are using the sanitizer, and you can sanitize all your personal items like utensils and the various door handles. Indoor air pollution increase the risk of pneumonia. Now, the new technologies can reduce indoor air pollutions, and additionally research is needed to demonstrate the health benefit of this particular interventions. And some of these strategies to reduce the indoor air pollutions may be prevent pneumonia, and we all must have to be encouraged by this strategy, means it is basically reducing the indoor air pollutions. And this is a strategy to prevent the mother to child. As I told you that there is some preventive measures we have to take to prevent the child transmission of HIV and improve the management of HIV infections. Now, these are some references, so you can go through these references. Thank you for your patience.